Pneumonia is basically an infection of the lungs. It may be caused due to a variety of factors, which mainly includes infection by microorganisms like bacteria, viruses, fungi, and in rare cases, parasites also. Apart from all this, there may be other causes of pneumonia like aspiration pneumonia, which may be caused if the patient is not conscious and he aspirates, or some of the mouth secretions of vomit goes into his windpipe or trachea, as we say, and from that the infection is caused. Other causes may also include ingestion of various chemical irritants like the phenyl or any kerosene or any other compounds like that. This is also called chemical pneumonia. So mainly we are concerned about infectious pneumonia, that is mainly caused by bacteria. Tuberculosis is one bacteria which is very prevalent in India, and it is rampant for causing pneumonia in specifically elderly population and those with diabetics. So apart from tuberculosis, other bacteria are there like Staphylococcus, Streptococcus, Pneumococcus. These also cause pneumonia mainly in the elderly and immunocompromised people who have lesser immunity. Apart from that, there are also viruses like we all know coronavirus. It causes pneumonia, and it has currently led to the pandemic, which is affecting all of us. Apart from coronavirus, we have adenovirus and respiratory syncytial virus. These also cause pneumonia. Viral pneumonia is a very dangerous pneumonia in the onset because it can rapidly lead to shortness of breath and patient having respiratory distress, which we know call as acute respiratory distress syndrome, ARDS. It is a very dangerous type of pneumonia in the initial stage. It may lead to severe consequences, but also viral pneumonia may be mild in nature and it may resolve spontaneously without the help of any medications. We also have fungal pneumonia, mainly in diabetics and those who have lower immunity, and also parasitic pneumonia. So the pneumonia can be due to various causes, and if it is caused by microorganisms like bacteria, parasites, viruses, fungi, these can be transmissible, and this can be transferred from one person to another. It is contagious. The cardinal signs and symptoms of pneumonia mainly include fever. Fever is one of the most common signs which we get in pneumonia. And apart from that, the patient will have cough. Now, the cough may be a dry cough or wet cough. Dry cough may have a certain amount of, a small amount of sputum with it, and wet cough will have a large amount of sputum, like every day around 1 cup or 2 cups sputum may be produced. So, depending on that, the pneumonia is also severity of pneumonia is also graded. So, if in cases of wet cough where there is production of excess sputum, the pneumonia is considered to be more severe rather than a dry cough pneumonia. And apart from that, if there may be shortness of breath, the patient may suffer from breathlessness. He or she may not be able to do her daily activities properly. And even while going to the bathroom or while changing clothes, the patient may have the severe shortness of breath and dyspnea, which may lead to hampering of the daily activities of the person. Apart from that, there may also be chest pain in cases of pneumonia. Like the patient will complain of severe cramping pain in the one side of the chest or on both sides. Normally, pneumonia, it is single side of the chest, not on both sides. It will be very high grade in nature. The patient will not be able to tolerate it. Even on taking painkillers or paracetamol, the chest pain won't reduce. So that type of chest pain signifies the patient may have pneumonia. In case of that chest pain, we have to consult a physician or a chest specialist in order to know whether the chest pain is due to pneumonia or heart disease. And also, there may be signs of hemoptysis. Hemoptysis means coughing out of blood in sputum. So there may be a bit amount of blood or a lot of blood may come out with the sputum. So accordingly, we have to test the sputum for any signs of infection like tuberculosis or any other causes of pneumonia. There may also be wheeze. Wheeze means a certain musical sound produced by the chest when there is an infection in the chest. It goes like this. This patient will be wheezing in cases of chest infection and pneumonia. So this is also found in many patients, especially those who are asthmatic or have different chest problems. Apart from that, there may be other symptoms of pneumonia. These are called atypical symptoms, like the patient may have abdominal pain, severe pain abdomen leading to a profuse diarrhea. The patient may have loose stool. The patient may be disoriented, may lose consciousness, may give irrelevant talks, and various other symptoms may be there. But the main cardinal symptoms of pneumonia include chest pain, fever, cough, and hemoptysis, that is expectoration of blood along with sputum, and also in some cases wheezing may be there. So if these symptoms are present, then we have to suspect that the patient may have pneumonia. The patients who are normally immunocompromised, that is, they have a compromise in their immunity, those with less immunity than normal people, like people with diabetes, people having old age with age our immunity decreases, those people who may have cancers or malignancy in any of the different organs of the body, those people who have HIV/AIDS, the immunity severely compromised, or those people who have any organ transplantation, who have undergone any transplantation of organs, or even those people who have implants in their body, like a pacemaker, or any fractures leading to the management by placing pins or plates in their body. These people are more prone to pneumonia. Also, those people who have chronic lung diseases like asthma or chronic bronchitis, who regularly may require steroids, which will reduce immunity, or any other autoimmune disorders like rheumatoid arthritis or any arthritis-related problems where they may need immunomodulating drugs. These people are more at risk for pneumonia. Also, those people who have addiction problems, like those who are regular smokers or drinkers who smoke a lot regularly, their respiratory immunity is severely compromised, and as a result, they're more prone to pneumonia compared to normal people. Pneumonia is mainly diagnosed with the help of blood tests, and apart from that, you will also need to do a sputum test. So blood tests, mainly the complete blood count, will help identify if any infection is present in the body or not. And supportive evidence of the sputum test, particularly for TB, tuberculosis, or any other bacterial pneumonia, is very useful in cases of diagnosing pneumonia. Also, a chest X-ray will help diagnose pneumonia if it is present in the lung in very large region. And HRCT, high resolution CT scan, is also very sensitive even in detecting pneumonia in small areas. So chest X-ray, high resolution CT scan, these are all imaging which helps us to detect any pneumonic patch, the white opacity in the lung. And apart from that, sputum will help us to know the causative factor of the pneumonia, be it bacteriological, be it fungal. Fungal stains are also available in sputum, which helps us to diagnose pneumonia. And also viral pneumonia, there are many methods, like in COVID, we have seen that we are doing RT-PCR of the nasal and oropharyngeal swabs. So RT-PCR of the sputum as well as the nasal or oropharyngeal swabs will help us diagnose in viral pneumonia. And parasitic pneumonia can also be diagnosed with the help of sputum or mainly blood tests, the ELISA. So blood tests, mainly the complete blood count or ELISA for parasitic, and fungal also. There are blood tests like IgG, fungal IgG, and sputum for mainly tuberculosis and other bacteriological factors, risk factors for pneumonia. And also chest X-ray and high resolution CT scan are the modalities which help us to diagnose if any pneumonia is present in the body or not. Also, there is one test called the Mantoux test, which we normally use for TB. If the Mantoux test is positive, then we will get to confirm whether the tuberculous pneumonia is present in the body or not. And there's a blood test called IGRA, interferon gamma release assay, which we do with the help of the ELISA method and quantiferon method to detect the amount of interferon gamma in the body. So if it is raised, we confirm that yes, there is tuberculous infection in the body. And also PCR methods, like the genetic methods that we similarly use for this coronavirus, it is also being used for TB to diagnose tubercular pneumonia in adults. And so a lot of new modalities, a lot of variety of investigations are available to detect pneumonia, but the basic involves the blood tests and the sputum and the chest X-rays. These three basic are required to diagnose pneumonia in a patient. Treatment of the pneumonia depends on the variety of the etiological factors which are present. Like in case of bacterial pneumonia, we mainly give antibiotics. Antibiotics play a vital role in treatment of the pneumonia if it is bacterial origin, like Streptococcus, Staphylococcus, or Klebsiella, or Acinetobacter. We do the sputum examination and also do a culture of the sputum to find out that which antibiotics are effective against these bacteria and whether any drug-resistant bacteria are present or not. So accordingly, seeing the antibiogram, that is a chart of antibiotics to which it is sensitive, we can appropriately give the proper management for the bacterial pneumonia. So for viral pneumonia, there is mainly no role of antibiotics. In cases of influenza, we can give a certain medicine called oseltamivir, Tamiflu antiviral, which is available. For COVID, no such antiviral has been found. So we are mainly focusing on supportive management, that is treatment of the fever, and if the pressure decreases, then we give adequate fluids and treat the cytokine storm with the help of steroids and supportive management, and give oxygen if there is severe shortness of breath. And in cases of fungal pneumonia, we have a variety of antifungal drugs which we give both in the form of tablets and injections. And for parasitic, we also have several anti-parasitic medications which we can give. They are also one form of antibiotics. So if the pneumonia is caused as per these cases, then we treat them accordingly. If the pneumonia is caused due to tuberculosis, then we give anti-tubercular drugs. These are well established now and have been going, this treatment protocol has been going over several decades now. The government has taken it up and it's providing very robust infrastructure to treat tuberculosis, even those with drug-resistant tuberculosis, which can be detected with the help of the nucleic acid amplification test, the NAT, which is widely available in all government setups. It is being used to treat the tuberculosis. Even the drug-resistant tuberculosis drugs are available, and most of it can be obtained free of cost by the government. Tuberculosis involves a long course of treatment, that is for 6 months, whereas this bacterial and viral infection, they normally resolve within 2 to 3 weeks, unless any other problems are present, like any underlying malignancy, lung cancer, or any chronic lung disease, that or if the patient is diabetic. So in that case, it will take a lot of time to resolve. And for the fungal and parasitic, they take a lot of time. Normally, you have to be under treatment for several weeks. And in cases of pneumonia, which is not caused by any parasitic or any bacterial origin or any infectious type of pneumonia. So for the non-infectious type of pneumonia, we mainly give steroids and nebulization, the gas, to help in breathing and maintain proper lung function, and they resolve after the inflammation has subsided with the help of anti-inflammatory and steroids. So according to the cause of the pneumonia, the treatment varies, but yes, antibiotics, anti-tubercular drugs, antifungal drugs, and antivirals if available, and steroids and nebulization, oxygen, these play a very important role in the treatment of pneumonia. Pneumonia can be prevented. There are various vaccines which are available for preventing pneumonia. One such vaccine is the pneumococcal vaccine, which is widely used. It is called PCV 13 and PPSV 23. Two types are available. So these are mainly given in cases of older age groups, people who are old and who have any comorbidity like diabetes or heart disease. It is very useful for mainly these people because they prevent pneumonia in these cases. PCV 13, you normally give one dose and it lasts a lifetime. And PPSV 23, every 5 years you need to give. So accordingly, you should consult your pulmonologist for which vaccine you should take. And for tuberculosis, there are many upcoming vaccines which are going to be present in the market over the next 3-5 years. Right now, there is only the BCG vaccine, which is given in childhood to prevent severe forms of TB like meningeal brain TB or spine TB or severe miliary TB, which are spread in the blood. But for normal adult TB, vaccines haven't yet come out, but they are in the pipeline and they will be releasing very soon. And for coronavirus, we all know that various COVID vaccines have available now, not only help to prevent the pneumonia, but also if the pneumonia happens, then the severity of the pneumonia will be greatly reduced with the help of these vaccines. Apart from that, prevention of pneumonia is essential not only by the medications, that is these vaccines, but also by our daily practices that we follow. That is, if we wear masks regularly when we go outside, we maintain social distancing, we maintain hand wash, then we can not only prevent this coronavirus pneumonia, but also tuberculosis, bacterial, or any other parasitic and fungal pneumonias also. So these are very good practices that if we follow regularly, we can prevent not only the spread of pneumonia, but also save the lives of many people, particularly those who have severely compromised immunity and those who are elderly. So not only the vaccines or medical treatment, but also our lifestyle practices like wearing masks, regular hand washing, sanitization, and maintaining social distance will also go a long way in preventing pneumonia. Also, there are certain lifestyle measures like taking insulin dose or anti-diabetic medication regularly, which helps to keep our sugar level intact. And uh, if we maintain our sugar levels, then the chances of having pneumonia, suffering from pneumonia, will decrease. And also, if we stop alcohol and stop smoking, particularly smoking, then it will also go a long way in prevention of the pneumonia, particularly the severe disease.